Attila Lee, a 61-year-old resident of Pittsburgh, Pennsylvania, was diagnosed with stage 3A Hodgkin's lymphoma in 1975 at the age of 12. In 1966, at the age of 3, his grandmother, who was giving him a bath, felt a lump in his right armpit.
My grandmother came to the United States to visit. She was bathing me. I was 3 years old, and found a lump in my right armpit. And next thing you know, they said, there's a lump here. And you know how parents are, they just think it's nothing. And about 9 years later, I ended up getting Hodgkin's stage 3. I had a spleen removed, big surgery, ending up with chemo and radiation treatments.
In 1993, Attila suffered a relapse. He had to undergo 6 months of chemotherapy, but his ordeal is not over.
I had secondary cancers, rectal cancer 2013. I had surgery, chemo radiation treatments. And then later I had colon cancer 2020, stage 2 colon cancer. And they removed 8 inches of my left descending colon and it reattached.
Treatment with chemotherapy and radiotherapy was not without risk. His treatment led to bone damage in the hip and eventually congestive heart failure.
2018, I had 2 hip replacements, 2018 and 2020. Again, this affected my skeletal, and also I have currently now I have congestive heart failure. It's inoperable. You can't do anything of it because of the extent of the differences of the deterioration from the chest radiation chemos from childhood.
Dr. Robert Ferguson of St. Jude Research Hospital in Tennessee, one of the many doctors, talks about his encounter and interactions with Attila.
So I am a associate professor of medicine. I'm a clinical psychologist for the Division of Hematology and Oncology here at the University of Pittsburgh Hillman Cancer Center. I was recruited here in 2016 to work on cancer survivorship research, particularly in the area of cognitive effects of cancer and cancer therapy. I was also seeing patients and survivors in a clinical setting at that time, and Mr. Lee was referred to me to see him for a host of memory problems, but also managing all of his medical problems as a result of childhood cancer and cancer treatment. It took about 6 to 8 months for him to get up the courage to come to our office. He had numerous appointments and had canceled again and again, quite anxious about seeing the cancer psychologist. Eventually, he did come into the office, and I did an evaluation for him, probably closer to 2017 at that point, or maybe early 2017. Looking at his medical record, his cancer history is extensive. So he was diagnosed and treated for Hodgkin's lymphoma at the age of 12, at a time when only 25% of children with that diagnosis survived. So right away, he was an anomaly. So one of 4 people, he was one of the 4 that would survive. Ironically, I'm about his same age, and I had a Little League baseball player teammate who had the same diagnosis, was treated in Boston at Children's Hospital. And that proved to be fatal. It only took a few months for that person to die of the same disease, essentially the same treatment course as Mr. Lee. So he is one of these rare survivors of that era, which was being treated in the 1970s. He is treated with high-dose combination chemotherapies that can result in damage to the inner cellular layers of the vascular system, can affect pulmonary and cardiac function, and also result in a higher risk of secondary cancer. In fact, the rate of secondary cancer among survivors who have been treated between the age of 10 and about 20 is about 25%.
Despite enduring and overcoming life-threatening medical problems that many wouldn't even want to face, Attila remains positive and constantly active.
Regardless of all those 2 stages I mentioned. It wasn't easy, but I did it, just to keep going. It's the attitude of continuous of physically, emotionally, and spiritually for me. Just to keep going. I don't let any health obstacles or any obstacles just put me down. The word is, I go through my obstacles that may knock me down, but it's not going to knock me out. So the attitude is, regardless of what stage of obstacles, whether it's health challenges or anything way of life of challenges, is not to allow the situation knock you out. It's normal for all of us to be knocked down, as long as we don't get knocked out through any kind of negative or any challenges. Not give up.
After nearly 50 years of battling a disease that has claimed millions of lives, Attila remains determined to continue his routine of daily exercise, yoga, and meditation.